Rosuvastatin generic 4. Crester Azaler. Rosuvastatin class. Rosuvastatin dosages. Tabs 5 mg, 10 mg, 20 mg, 40 mg capsule sprinkle 5 mg, 10 mg, 20 mg, 40 mg. Rosuvastatin FDA label indication. Disorder of cardiovascular system primary prophylaxis familial hypercholesterolemia 10 to 20 mg per qd meter 3 to 40 mg per qd. Hyperlipidemia. Adults 10 to 20 mg per qd meter 3 to 40 mg per qd. Children 10 to 17 yo 5 to 20 mg per qd meter 3 to 20 mg daily. Off-label uses. None. Contraindication. Hypersensitivity to rosuvastatin. Active liver disease use in breastfeeding pregnancy first trimester. Drug interactions. Agents mechanism clinical management. Antacids. Decreased absorption of rosuvastatin. Separate co-administration by 2 hours. Bile acid binding resins. Decreased absorption of rosuvastatin. Give rosuvastatin 1 hour prior or 4 hours after resin. Amiodaronazole antifungals. Protease inhibitors. Fibrates. Niacin cyclosporine. Increased risk of myopathy or rhabdomyolysis. Avoid concurrent use. OR monitor for myopathy and measure creatine kinase levels. Warfarin. Increased risk of bleeding. Monitor INR with addition or withdrawal of rosuvastatin. Adverse reactions common. Arthralgia, pain in the joints. Adverse reactions less common. Abdominal pain, asthenia, lack of energy, physical weakness, constipation, diarrhea, indigestion, headache, increased liver enzymes, influenza-like symptoms, myalgia, pain in muscle, nasopharyngitis, inflammation, upper respiratory tract, larynx to nausea, pharyngitis, inflammation of pharynx, rhinitis. Adverse reactions rare but serious. Rhabdomyolysis, the destruction of striated muscle cell, tendon rupture, partial or whole separation from tissue. Key patient counseling points. Do not drink alcohol. Med does not replace diet or exercise to lower cholesterol levels. Atorvastatin generic 4. Lipid 10 mg, 20 mg, 40 mg, 80 mg. Hyperlipidemia. 10-20 mg per qd may increase to 80 mg per qd. Primary secondary prevention of atherosclerotic cardiovascular disease. 10-20 mg per qd may increase to 80 mg per qd. Secondary prevention of cardiovascular events with or high risk for CAD. 80 mg per qd may reduce to 40 mg as high dose is not tolerated. Familial hypercholesterolemia. Adults 10 to 80 mg per qd. Children 10 to 17 yo 10 mg per qd may titrate to 40 mg per qd. Contraindications. Hypersensitivity to atorvastatin use in breastfeeding, active liver disease, unexplained persistent elevations of serum transaminases. Drug interactions. Agents mechanism clinical management. Aliskiren. Increase aliskiren concentration and risk of toxicity. Monitor for hypotension. CYP3A4/5 inhibitor clarithromycin, erythromycin, diltiazem, itraconazole, ketoconazole, ritonavir, verapamil, golden seal and grapefruit. Decrease atorvastatin metabolism and increases risk of atorvastatin toxicity. Avoid concurrent use or monitor myopathy. Measure CK levels. CYP3A4/5 induces phenobarbital, phenytoin, rifampicin, St. John's wort and glucocorticoids. Increase atorvastatin metabolism and reduce effectiveness. Monitor fasting lipid panels. Cyclosporin HIV protease inhibitors, hepatitis C protease inhibitors. Increased risk of myopathy or rhabdomyolysis. Avoid concurrent use. P-glycoprotein substrates. Transport of P-glycoprotein substrates inhibited by atorvastatin results in substrate toxicity. Monitor for adverse effects. Reduce substrated PRN. Adverse reaction common. Myopathy, diarrhea, headache, nasopharyngitis. Less common. Increased liver enzymes, indigestion, insomnia, musculoskeletal pain, myalgia, nausea, increased HbA1c. Adverse reaction rare but serious. Rhabdomyolysis, tendon rupture. Key patient counseling points. Avoid excessive alcohol. Grapefruit and grapefruit juice med does not replace lifestyle changes. Continue diet and exercise. PRN contact drive if muscle tenderness or weakness occurs. Pravastatin generic for Pravachol. Reductase inhibitor class. Dosage tablet 10 mg, 20 mg, 40 mg, 80 mg. Cerebrovascular adjuvant coronary arteriosclerosis. 40 mg per QD. Familial hypercholesterolemia. Children 8 to 13 yo 20 mg per QD. Children 14 to 18 yo 40 mg per QD. Adults 40 mg may titrate to 40 to 80 mg. Hyperlipidemia. Children 10 to 17 yo 10 mg per QD may titrate to 20 mg. Adults 40 mg may titrate to 40 to 80 mg. Contraindications. First trimester breastfeeding. Drug interactions. Agents, mechanism, clinical management. Bile acid binding resin, cholestyramine, cholecalciferol and cholestyramine. Binding by bile acid decrease efficacy of pravastatin. Pravastatin 1 hour before or 4 hours after resin. Efavirenz nelfinavir. Decrease pravastatin levels, decreases efficacy of pravastatin. Monitor fasting lipid panels. Fibrates, niacin, cyclosporin. Increased risk of myopathy or rhabdomyolysis. Avoid concurrent use or monitor for myopathy. Measure creatine levels. Adverse reactions common. None. Adverse reactions less common. Headache, heartburn, increased liver enzymes, influenza-like symptoms, musculoskeletal pain, myalgia, nausea, rash, vomiting. Adverse reactions rare but serious. Rhabdomyolysis, tendon rupture. Key patient counseling points. Take in the evening. Avoid concurrent heavy alcohol use. Pravastatin does not replace lifestyle habits.